I'm Cliff with the Salute America team here at UT Health San Antonio. This is the next webinar in our series, Let's Address Health Equity Together. Today's webinar is How to Care for the Latino Caregiver. Our moderator is Dr. Amelie Ramirez. Dr. Ramirez is Director of Salute America and its home base, the Institute for Health Promotion Research at UT Health San Antonio. She spent over 30 years directing research on human and organizational communication to reduce disease and cancer health disparities affecting Latinos. She's also Associate Director of Cancer Outreach and Engagement at our NCI designated Mays Cancer Center at UT Health San Antonio. Dr. Ramirez.
Thank you so much, Cliff, and welcome to our panelists and to the audience. You know, we have a really important topic to discuss with you all today. As you know, that Alzheimer's is 1.5 times more likely to occur in our population of Latinos compared to non-Hispanic whites. And so we have so much to learn, not only how to care for our patients, but how to also be good caregivers as well. And so I'm really excited to be able to discuss this topic with you all today. Caregiving is one of the most gracious things that we can give to a loved one or a family member, but it's not easy, and there are many challenges. This is especially true for Latinos, who face a number of social health inequities that contribute to higher rates of certain cancers and other diseases like Alzheimer's. And fortunately, we have a wonderful panel here today to help us navigate this whole process and to help us be better Latino caregivers. So today I'm going to introduce several of our speakers, and then the last introduction that I'll give will actually start off with our presentation. So again, this morning, or depending on where you are, we welcome all of you to this panel. Our speakers will be Jason Resendez, who is a Latino advocate and leader of the National Alliance for Caregiving. Dr. Claudia Sabizalba, who is a dementia researcher at the Biggs Institute at UT Health San Antonio. Melissa Flores, who is a clinical counselor at the Biggs Institute. Dr. Sarah Massad, who is leading outreach for caregivers at UT Health San Antonio. And Thomas Britton, who's a loving Latino caregiver for his mother. And our first speaker today will represent our webinar sponsor, Genentech, a biotechnology company and a member of the Roche Group. Janae Williams is Director of Patient Advocacy Relations, Alzheimer's and Parkinson's diseases at Genentech. Janae, can you tell us a little bit about how Genentech is addressing caregiving?
Sure. So first, I would just like to say thank you for the honor of joining such a distinguished panel for, as you mentioned, a critical discussion. We at Genentech understand the importance of the lived experience and recognize that everyone's caregiving journey is different. With that in mind, as we think about Latino communities that we serve, we understand it's important to engage community members to ensure that we can meaningfully come alongside them to provide support and relief in ways that matter, and really ensuring that we're meeting people where they are. The caregiving community is very important to us, and a few ways that we've been engaging are, first, we've really been working to explore and understand the needs of caregivers across disease areas, especially including Alzheimer's. And we've been partnering with organizations to uplift policies that will provide caregiving relief, including some work that we've been doing with Jason. Second, about 1.5 years ago, we created a community listening series, which allowed us to listen to key communities and voices to understand the lived experience, including a really powerful conversation with caregivers. During that conversation, we had the opportunity to hear, with the full agreement of those participating, the great need for respite, as well as the importance of having a support system, as taking care of loved ones, as we know, can be really, really challenging. And then lastly, I'll quickly share, we've begun working with a few promotores groups to really gain the insight about traditions in Latino communities and to understand current challenges, including access, education, resources, and others, to understand how we can best show our support from a pharma side. Of course, this is not an exhaustive list, and there's a lot more that we can continue to do. As I shared before, and as we all know, everybody's caregiving journey is different. I've had the privilege of partnering with my mom to care for my grandmother who had an unspecified case of dementia, and she passed away last year. And while that journey was so challenging at times, there were also some beautiful memories that we were able to make. And it's both the challenges and the beautiful moments that we at Genentech need to keep close and make sure that we keep those in the conversations to make sure that the work that we're doing both now and in the future meets Latino and other caregiving communities where they are, which I think is most important.
Thank you. Thank you so much for those inspiring words, Janine. There is so much that we need to learn and to also be able to say, we do the best that we can in the different approaches that we might take to care for our loved ones. So thank you so much. Dr. Sabisalba, we know that we should make sure to understand the issue at hand. Why is Alzheimer's disease and other dementias so prevalent among Latinos? And what are some of the main risk factors?
Yes, thank you so much, Dr. Ramirez. I'm thrilled to be here, and thank you so much for the invitation to this wonderful event. Yeah, as you mentioned, the research suggests that Hispanic or Latinos are 50% more likely to develop dementia and Alzheimer's disease compared to our non-Hispanic white counterparts. And this gap has unfortunately remained constant over the last decade, suggesting that there's been very little change to lower that risk among Latinos. But not only that, if nothing changes, the current projections estimate that Latinos in the US will have the largest relative increase in dementia by 2060. Therefore, it's such an important question because, of course, we want to change things and we want to revert that projection. So the truth is, we don't completely understand all the drivers leading to this disparity. And one of the main problems is that Latinos are not very well represented in research studies, including those investigating brain aging and dementia. So in fact, some recent research suggests that among research participants in different studies, only less than 6% of those participants identified as a Latino. So of course, this is unacceptable. We need to do better as researchers. And the good thing is that things are changing, and now several stakeholders, research institutions are recognizing the importance of including more diverse of participants in our research studies. And this is something at the heart of our the work we do at the Biggs Institute. And that is really one of the main ways to get true answers that are relevant to our community and the risks in our members. So, but just to, in general, we know that one of the most important factors related to brain health is cardiovascular health. And perhaps you've heard this before, but I'm going to say it here again. What is good for the heart is good for the brain. And so it's very important to check on all those vascular risk factors, such as diabetes, obesity, lipids, smoking, hypertension, and make sure you control and have a plan with your primary care physician. In general, keeping a good cardiovascular health is protecting your brain and ensuring the best as you age and to lower the risk of dementia. Unfortunately, we know that some of these factors are very prevalent in our community. For example, diabetes and obesity. And that may be one of the reasons why we see a higher risk among Latinos in general in the US. But the good thing is that these conditions are preventable and treatable. We have excellent strategies, so we can do something about it. And this is part of the work we do to decrease the risk of dementia.
Great. Thank you so much. You've given us a lot to think about there, and we'll go into a little bit more detail during the question and answers. But thank you so much. Jason, you're an amazing advocate for Latinos who have dementia and their caregivers. Why is caregiving such a normal role for Latino families? And how is the Latino caregiver population growing?
Thank you so much, Dr. Ramirez, for having me and for your kind words and for your leadership. You hit the nail on the head. Caregiving is common in the Latino community. It's interwoven into the Latino experience in so many ways, right? Nearly a third of Latinos live in multi-generational households. So the realities of caregiving are more present, and there's a deep cultural expectation around caregiving in the Latino community and in many communities. I'm sure many of us on this Zoom, and both in terms of the participants and the panelists, have a caregiving story in one form or another. I know for me, my caregiving story comes through my mom. I grew up watching my mom raise 3 kids while working a full-time job and taking care of my grandmother, who lived with multiple chronic conditions, a dynamic all too familiar in Latino households across Texas and across America. And in fact, I am from Corpus Christi, just about 2 hours south of San Antonio. So I know the region well, and the impact of caregiving that happens across our community. And she's not alone. We're not alone. The Latinos providing care in this country number 9 million as of 2020. The average Latino caregiver is a 43-year-old Latina. She's likely married and has children under the age of 18. She's also more likely to be in high intensity caregiving situation, providing 26 hours of care a week, assisting with at least 2 tasks of daily living and 2 medical or nursing tasks. So we look at caregiving intensity as measured by the number of hours of care provided a week and the number of medical tasks and tasks of daily living that caregivers assist with a week. And Latinos are more likely to be in high intensity care situations. So what that means is that they're providing more hours of care on average in other groups. They're providing assistance with more complex medical tasks than other subgroups of caregivers. And that has consequences. It has consequences in the form of health impacts. Latino caregivers are more likely to report worse self-reported health outcomes due to caregiving. And they're also more likely to report negative financial impacts due to caregiving. So we know that, for example, Latino caregivers are typically working while they provide care, almost working full-time, about 36 hours a week in a non-hourly paid job. And as a result of that, balancing care and also work at the same time, and often complex care, which is certainly the case for individuals providing care for someone living with Alzheimer's or another form of dementia. That complexity has impacts. Latino caregivers experience about 2 negative financial impacts due to caregiving. That's more than when compared to non-Hispanic whites, for example. And what those impacts look like, it looks like stop saving for retirement, going into debt, leaving bills unpaid. I know that was the case in my family. I know I grew up watching my mom worry about having to dip into her savings in order to fix a car if our car broke down. So there are these impacts that caregiving makes, has these ripple effects on a family and on a community. And so it's important that we have these conversations, that we normalize what care looks like, knowing that there are millions of Latinos who are connected by this bond of caregiving. There's so much that we need to do to destigmatize that care as caregiving in the Latino community grows. And there's also an urgent need for us to start to address the underlying reasons for that care. So really looking at how we prioritize and address health disparities like Alzheimer's in the Latino community. One of those issues that before I started working in the Alzheimer's community, I had no idea that Latinos were more impacted by Alzheimer's than non-Hispanic whites. And so it's that education, that awareness, that public health work that is really critical to help us address the underlying reasons for providing care. So our work is not to cure caregiving, right? Caregiving will always be with us, but it's to make caregiving easier, more sustainable, and more equitable so that Latino communities can thrive at home, work, and life. And happy to be here to help contribute to that with all of you.
Great. Thank you so much, Jason. And all of that is so true, you know, and even though sometimes they're, you have a large family, and usually the caretaking falls on one person, usually one person out of the family steps up, to help. And so helping us balance that across different family members are important topics to also to talk about. But thank you for sharing that. Our next speaker is Melissa. Melissa, you have counseled many families who are caregiving for loved ones. What is the typical experience of Latinos who are caregiving for their parents, grandparents who might have Alzheimer or dementia?
Thank you. Thank you so much for asking me that question and for also allowing me to be here. I really appreciate being able to highlight some of the more mental health components of caregiving as well. And I'm really happy to have been able to go after Jason because he hit it right on the head in terms of challenges that are typical in what I've seen professionally and personally. I think there is these very specific challenges to Latino caregivers that have a lot to do with our cultural expectations and the situations that we often find ourselves in these caregiving roles in families. As he mentioned, it's oftentimes an entire family caregiving. It's not just, a spouse or one specific individual, but we're looking at the entire unit being affected by the person who's living with a diagnosis. Everybody is touched in their, need to offer support or offer challenges. But you also are right in what you said earlier, in that it typically falls the majority of the responsibility on one person. And some of the things that we might see become a challenge for that individual is just the responsibility of trying to caregive while also working or caregiving for their own families. Many of our caregivers that we see have young children, or they're working full-time jobs and trying to manage those expectations as well, while navigating a lot of the emotional challenges that come with caregiving. I think Jason touched on it, is there's just a kind of woven expectation into Latino culture of this is your responsibility, and many caregivers take that with great bravery and want to take on that challenge, but it is a heavy burden that can be difficult to maintain. And so there aren't as much accepting of outside help or things like maybe doctors might recommend of facility placement or in-home care. That's not always taken advantage of as easily because there is this personal expectation. Oftentimes other emotions like guilt, frustration, stress, those things come in. But something that we often see throughout all of these challenges is an emotion of grief, all while you're still taking care of your loved one, you're still managing the day-to-day responsibilities, you're very much grieving the changing relationship and changing personality that might accompany that as well. But some challenges that are faced are, as many of you had already mentioned, access. There's not always a lot of access to support, education, or just resources. And in my own community in South Texas, where I'm from originally, there's very, very little of support groups, of education opportunities, of just understanding and deep opportunities to destigmatize the situation, as well as just access to providers. In our clinic, we have people that come from all over South Texas because there aren't opportunities for individuals to take their loved ones to local neurologists who really understand, as well as can offer support to these types of families living with this diagnosis. And just with that as well, community support. And so all of these things, and just this talk today, I'm really glad to be able to be a part of it to help start that conversation around not only are more resources needed or more access to healthcare, but just also more conversations, including Latinos, and having them be involved and share their perspectives on what is needed for their various situations. Thank you.
No, thank you so much, Melissa. And I think another issue that we encounter of Latino families is el respeto, the respeto that we have for our family member, and kind of deciding when is the right time to try to really get the care that they need, but at the same time knowing that your loved one is saying, no, I don't need it. And, just trying to balance all of that, to not feel guilty that you're not, that you're doing the right thing or not doing the right thing, because you don't want to lose that respect of your family member, particularly, a parent that you care a lot about. So thank you so much for those words, Melissa. Thomas, you're just a loving caregiver for your mom. Can you tell us about who you're caring for and how that experience has been for you?
Yes, my name is Thomas Britton. I take care of my 80-year-old mother named Sarah Cadena. She was diagnosed with Alzheimer's about 5 years ago. But really, our story with Alzheimer's started about 12 years ago when I was asked to go to her neurologist appointment with her, and her neurologist advised us she began to show signs of mild cognitive impairment. He suggested that she come live with a family member because she was getting forgetful, not taking her medicines all the time. Because she's self-reporting this, forgetting to leaving the fire on the stove, starting to have some difficulties balancing her checkbook and things of that nature. So she came to live with my family and I. I have 4 children. My wife, 2 of my daughters, and my younger brother all were caretakers for about a year and a half, give or take, during that first 8 years that she was with us. During that time, I started going with her to her doctor's appointments, and I began to see that she wasn't remembering everything clearly or 100% what the doctors were asking her to do. And so it was a great benefit that I went with her to the appointments and kept notes, and we kept track of stuff. I also found that she would tend to exaggerate a little bit or not give good, clear answers to the doctors, which resulted in her being over-medicated or over-prescribed medication. So I pretty much wasn't too happy with some of the doctors. There was kind of real cursory visits. So I found her a new neurologist and a new primary care or geriatric doctor at the UT Health Science Center, which was a blessing for us to get there. They really made a huge impact on my mom's care. They were concerned about the amount of medicines and gave us solutions where the other doctors weren't giving us solutions or being helpful in their future, giving us kind of an idea was what was to come and giving us resources. Anyway, during that 8 to 10 years that she first came to live with us, we started noticing some changes in her behavior. She was an avid reader. She didn't read as much or read much slower. She wasn't as involved in the stuff slowly over the years in things that she was interested in. We had to come up with things to help her remind her to take her medication. We started off with we had a list of times that she could follow and check them off throughout the day. We had a checklist. Then it progressed to putting alarms on her cell phone. For a few years that worked. Alarm would go off. She'd take her medicines, do whatever she needed to. But eventually she just swipe and dismiss the alarm and continue watching TV. So, we had to adjust ourselves to be more available and to be more helpful during this time. Around 2018, she was diagnosed with Alzheimer's, the onset of Alzheimer's, which for me, it was fortunate that I was able to retire. I had 30 years of civil service. It almost coincided exactly a few months. I retired a few months later, she's diagnosed with Alzheimer's. And I know that's not the norm. So I was fortunate enough that I didn't have to work anymore. So my mom's, for the last 5 years, been her full-time caretaker. She's been my companion, or I'm hers. We're joined at the hip. So that's kind of a blessing for us. I'm able to interact with her throughout the day. Most of the day I spend with her, and then in the evenings when my wife gets off work or one of my children comes home from school or from work, I'm able to go to the gym and they'll continue the care. But I just want to reiterate that finding a good healthcare provider, I'm not saying the doctors are bad. Some are just like any other person. Some may have a personal connection, as some of the doctors here as caretakers, and others may not have. Find a doctor that fits well for you and your family, that offers resources. Don't be afraid to look for another doctor. What I did was I got my mom's insurance, found out who's the network, started researching the doctors, see how they're rated and reviewed by their peers and by the patients. And that's how I got to the UT Health Science Center. I got connected with Dr. Masood and many of the other folks here. The neurologists there are excellent. They kept referring us to other neurologists and other specialists. We got involved with Melissa here. There's so much at the UT Health that we didn't get anywhere else. We get a monthly call from a social worker. We keep getting emails about events that are coming up. We partake in a lot of events. There's stuff that goes on at the museum, the botanical gardens. There's a memory cafe. There's just so many different things. Meals on Wheels offers a whole lot for caretakers. They have the the Grace at Home, where they mail a gift to your loved one once a month that allows them to be entertained. They have a choir that we go to every Friday with other Alzheimer's patients, allows for us to have a community to gather with, which is very important. Like for my mom, having a structure is very good. Having someone to interact with that's in the same condition makes her less fearful of what's to come with Alzheimer's. Like I said, we've been very fortunate, and we're very grateful. I know not everybody lives in a large urban area. I'm from San Antonio, and we're very grateful to have all these resources. Although I have family members that live in rural South Texas that didn't have all these resources, I try to tell them and help them look for stuff. I send them emails. I send them anything and everything we can. My mom loves to be on Facebook with family, so everything we do, including today, will be on Facebook, and we try to just reach out, let everybody know that, Alzheimer's is not her fault, not our fault. It's nothing to be ashamed of. We try to share all the information we can with others to help them. And I'm really grateful that I got involved with UT Health, because I'm here because of UT Health. And I just want the people to know that as a caregiver, I'm telling you that I do a lot with my mom, and I know that might not be possible for everybody because they're not retired and they have to work. But what I do want to stress is the more that you can get out of the house with your loved one, the better off it is for them and better off it is for you. You'll get to meet other folks. He or she'll get to meet other folks, and it'll make the things much easier for you. My mom and I walk every day about a mile, give or take with the heat. We play cards. It's a lot of routine. We play dominoes. We play kings on a corner. We do loteria. But it breaks up the monotony for the caregiver, and the same for them. I could just have my mom sitting in front of TV, right, vegetating, and it wouldn't be very good.
Lots of amazing strategies that you're sharing. So thank you so much, Thomas. Those are, and it takes time. It takes planning. It takes, organizing and doing these things. Just real quick, what do you do for yourself to take care of yourself?
As I said, I walk in the morning with my mom, and we're out running errands, but I try to go to the gym every day, whether it's on a treadmill, a cycle, or just something every day just to keep me going. And that way I'm better equipped to handle my mom's needs.
That's great. Well, thank you so much. We really appreciate that. So now I'd like to introduce and I want to congratulate her to Dr. Sarah Masad. She recently got her doctoral degree. We need more of you in the field. So we're really excited. So Sarah, can you share with us some of the programs that UT Health San Antonio has for caregivers, and maybe briefly describe your memory cafe events? That sounds amazing.
Oh, I'd love to. It's my favorite thing to talk about. Before I do, I want to also echo the words of gratitude that the other panelists shared to everybody on this call, and to Salud America and Genentech for hosting us. But I also want to thank Thomas for always being here and always being really vocal about his experience and advocating for other caregivers to leverage the strengths that every person and every family structure already has. To find the resources to support them in the areas that they may need help. So Thomas, thank you for joining us on this call and sharing your experience. So I am the program manager for an incredible program called Caring for the Caregiver. We're at UT Health San Antonio School of Nursing. I'm really proud to represent this program. The visionaries who established the program at sort of in the end of 2017 understood right at the get-go that you can't develop a program without having a relationship with the community that you're trying to support. So the program was developed in response to what community members had expressed were the gaps that they felt were in San Antonio at the time of its creation. And then the founders, especially Dr. Carol White, who established this program, and just recently retired, but is still involved in the program in the development of evidence-based interventions, which I'd really like to share about today, particularly one that I'd like to highlight that focuses on Latino family caregivers, but understood the importance of constructing systems of accountability and relationships with the community to ensure that we sort of always have our compass oriented to what do family caregivers right here in our zip code and, sort of in our regional area of South Texas need to live better lives. So some of the programs that we offer, I'll start with talking about the memory cafes. When Thomas shared that he attends them, I was really excited. You know, we heard from Melissa, we heard from Jason and Claudia and Janae about the importance of supporting caregivers in every way. So we provide education opportunities as well as engagement opportunities to try to combat some of those experiences of social disconnectedness that caregivers often experience due to their role and their responsibilities, providing care to a person living with dementia. Thomas is an incredible example of somebody who's been able to construct his life in a way where he can care for himself to provide better care for his mother who's living with dementia. The memory cafes target that social engagement, that social interaction need that families, every family needs, but in particular, people living with dementia and family caregivers. We know that having a better connectedness to your community decreases the risk for other negative health outcomes. So we have memory cafes. This is a concept that started in the 90s in the Netherlands and sort of took over the world by force. These are inclusive opportunities. Usually they have some sort of creative activity, maybe some sort of physical activity or educational component. The core sort of aspect of a memory cafe is that they align with the interests of the community that's participating. So our memory cafe, the SA Amigos Memory Cafe, tend to be a creative bunch of folks. They really enjoy singing. They really enjoy games. I mean, we can't plan enough games of Loteria with our SA Amigos Memory Cafe. We play Loteria several times. During the pandemic, our memory cafe went virtual. So we partnered with UT Rio Grande Valley to provide a bilingual component to our memory cafes to be inclusive of people who only spoke Spanish. And now that we're back in person, we ensure that there's always somebody there who speaks Spanish. And we sort of are on the road now where we move our memory cafe in different parts of the city so that we can be in predominantly Latino and Hispanic communities rather than staying, sort of quote unquote forever north, as one of our family caregivers shared with us. And then I'd like to highlight one of our education interventions or programs that's being developed by Dr. White and our Caring for the Caregiver team of researchers in partnership with family caregivers. There's such a need for caregivers to learn the hands-on skills that they need to provide care that also does not put themselves at risk of harm in terms of stress, but also potentially physical injury if you're trying to move someone in and out of a bed, for example. So Dr. White and her team have partnered with Latino family caregivers, and they've co-created an intervention called Juntos Together. This is a 6-week program that caregivers can enroll in. And I'll put the link in the chat, or I'll ask somebody to put the link in the chat for anyone who's on this call who's interested. It's still running through the end of the year. I think I cannot sing enough praises about these programs that are developed in partnership with communities. That way we know that they're directly aligned, and they're not just programs that were developed by white people, for white people, non-Hispanic white people. These are interventions that are trans-adapted. We're taking what we know has worked for caregivers, and we're not just translating them to Spanish, right? We're actually looking at not just the content in terms of language, but how can we deliver education and deliver programs in a way that resonates with the cultural experiences and beliefs and values of the community we're trying to support. And Jason touched on that when he was talking about caregiving, which is woven into our identities. I come from an Arab household. The word caregiver, when I was caring for my grandfather, never entered my vocabulary. I did not know that I was a caregiver. I knew I was a granddaughter. And so how do we make sure that we're developing programs that really resonate with our concepts of family and care that maybe are not necessarily aligned with the words that researchers and providers use? So yeah, I'd encourage people to check out utcaregivers.org to learn more about our program. Thank you so much.
No, thank you. All of those are just some amazing programs, and already we're seeing comments, how do we access them, and where can we find more of these programs if they're not available? So, and people are answering questions. So thank you. If you have any questions, please place them on the chat. and we'll make sure we can guide it to the right panelists for you. So I'm going to go back to Janae. And Janae, you know, Genentech is noted for helping come up with drugs that can hopefully treat, you know, our different illnesses, Alzheimer's, dementia, Parkinson's, and so forth. But what else can our industry leaders be involved in working with caregivers?
You bring up a really great point, and I was thinking about as Dr. Masad was speaking, I think we can do more to engage community in partnership, listening and learning. So I have the privilege of sitting in the advocacy team, as you had shared earlier, and really our top priority is listening and learning. And we like to listen and partner with organizations who are expert in this field to help us understand. Thomas, your sharing your journey was so powerful. I almost wanted to tear because there are so many who are going through, who have the privilege of being able to spend that quality time. And as you mentioned, everyone's journey is different. So when I think about what we from industry can do to better support the needs of caregivers, it's one, partnering with organizations who have that trusted relationship in the community so that we can understand the dynamics, what's needed, and what's appropriate for us as we seek to kind of support from an industry perspective. And then once we understand the needs, and as I always say, like our guardrails and where we can play, I think that's when the real fun begins. And as it was shared before, how might we be able to co-create necessary programs and resources that are needed in specific Latino communities? Because we recognize the rural communities are going to be different from the urban communities, are going to be different from those where maybe there's only one child who, you know, a lot of this burden falls on, and how might we be able to meet people where they are and identify ways that we can support, be it through the supporting memory cares that you said. We used a project or a program that included, oh my gosh, I can't even think of it now, Legos. And it was how to support caregivers themselves through the building of Legos, as well as people who were living with cognitive decline, and what that looked like as family activities and as a way to bring out some of those memories in people that have been buried away for a little while. So I think there are a number of opportunities, but I think our first thing is how do we show up and show our genuine interest in wanting to learn and become a trusted partner? And then once we've earned that trust and you all trust us enough to join you, how might we come alongside you to really just support what local communities need? Because it's not about what we need or what we think someone else needs. It's about how do we meet people where they are.
Exactly.
And so we're working on that.
Beautifully said. Thank you, Janae. Thank you so much. Claudia, I've learned that there might be differences among our Latino populations with how we see Alzheimer and dementia, particularly Hispanic Caribbeans versus non-Caribbeans. Do you have any thoughts or comments about that?
Yes, so we just use the word Hispanic or Latino as monolith, but in reality, there's so many subgroups, each with their own cultural roots. Yes, so there are several factors that may be more prevalent in certain communities. That is why it's so important to participate and have a real representation of the full diversity of the communities.
Okay, yeah, and we're seeing that incidence varies too, right? In terms of some of these with regards to Alzheimer's and dementia. So again, that participation in clinical trials is critical so that we can learn more about the diversity of our Latino community. Okay, we actually have a couple of questions here from the audience. And so the first one is, I'm wondering if you know of any support groups for caregivers that are more general for someone that is a caregiver for someone with mild cognitive impairment, not necessarily, at the Alzheimer or dementia stage.
I can address that one. There are a lot of, and I know we have a lot of national attendees and not just local to the San Antonio or South Texas area. And so I encourage, reaching out to any organizations that might have access to these types of groups. For example, local areas on aging have a lot of resources that can connect you with different groups, because might be local chapters of, for example, in our community, there's WellMed, who hosts several support groups for our community. Alzheimer's associations, I know that question was asking about not Alzheimer's specific, but there are a lot of support groups that actually house attendees that are dealing with Lewy body or FTD or early stages of cognitive decline. And so it doesn't always get into the sort of specifics of Alzheimer's disease. And I think just having a support network would be important if you're unable to find just kind of a general caregiver support group. There's a lot of really local organizations. And so I just encourage you to do some research or reach out to local area agencies on aging. I know for us specifically, and I wanted to have an opportunity to share this as you asked me the question about those caring for a parent or a grandparent. We host a virtual support group for those that are caring for a parent living with dementia. And this is actually, through pandemic, become a national group. We have people who join from Washington and New York, different areas. And we really, really appreciate this group because it highlights the unique experiences of a parent, of a adult child caring for a parent, such as role reversal and those unique kind of nuances of trying to parent your parent and help them through this diagnosis. And so that's one I wanted to just share as well, is an adult children caring for a parent support group. But I really encourage support groups because they are essential in getting that community support, getting that opportunity to talk through challenges that you might not feel comfortable doing with your family or close friends. It's a perfect opportunity to do that.
Great, thank you. There's another question, maybe for Sarah or Melissa or even Thomas or Jason. You might have some comments to this one. This is, how can someone speak to caregiver guilt when they no longer can care for their loved one at home and need to access a memory care facility? The caregiver role becomes more limited, but the advocacy role is greatly expanded. But there are feelings of guilt and abandonment that go through in making this decision.
I'll kind of hop in just because you said my name first, but I also would encourage Melissa also to share from her experience being a licensed professional counselor. I want to start with this question that came through. We have a program called the Caregiver Reassurance Program, where students in the health professions and nursing programs here at UT Health call family caregivers. In terms of a long-term basis, so they'll be paired over several months and in some cases years. And so what our team did is we took the notes that are taken on these calls and we actually analyzed them. We found that grief and guilt are experiences, these complicated feelings are one of the most prevalent experiences in the caregivers. And this is coming from an analysis of over 500 calls. So I want to sort of acknowledge that guilt is something that sort of goes hand in hand. And there is a cultural component also with feelings of guilt and obligation, in terms of a role to a person in your family. So whenever you're trying to make a decision, that's an added complication. It's not just about money. It's not just about, resources or finding the right facility. There's this emotional battle that's happening. I don't want to sound like a broken record, but I will say that support groups are a really great place to get guidance and to get the tools that are needed. I think dementia and caregiving is highly stigmatized. I still think support groups are experiencing a lot of stigma around what it means to participate in a support group. And that's why I kind of am a broken record about get involved in a support group, because I've seen that this simple structure of being in a space with other folks can be like more powerful than attending any lecture or making, being around people who understand from lived experience. So I will say that is one of my strongest recommendations, is to find a support group, whether it's online or in person. I'll kind of stop talking there to allow the other panelists to build on that.
Maybe a few words from Melissa, Jason, and Thomas.
Sure, I can just quickly touch on, as Sarah mentioned again, and I said it as well, so I'm a bit of a broken record, support groups are important. We actually created a grief and loss focused support group as well, because this is such a common experience of caregivers, is that guilt that comes from that sense of grief and loss in the change that is now required of them. And we oftentimes are looking for some way of taking control of this grief and loss, and we take that on as guilt of, I should be able to stop this, or I should be able to fix this, when oftentimes it's the reality of the loss, which is really difficult. And the only feedback I would offer is, really allowing yourself to acknowledge those emotions, to acknowledge that guilt, those feelings of grief, to be able to allow yourself not to just feel like you need to power through it, but also something that we talk a lot about in our groups and in my individual counseling is being able to allow for both. You can feel both guilty that this is something that you're having to do and having to choose, and know it's the best option for the situation that you're in at this moment, and kind of giving yourself that grace of both can be true, and it's difficult no matter what. Thank you.
Thank you.
Yeah.
Jason, and then
And-
Thomas, or
Yeah.
Thomas?
I'll go. Yeah, no, I would just add, I think it's this overwhelming sense of guilt underscores the reality that there's a systemic failure in this country to support family caregivers and caregiving generally, right? We feel guilt because we think it's something we did wrong, the inadequacy with being able to afford care, inadequacy in terms of making the right decisions. Could I have done this differently? When in reality, caregiving is a societal good. This is something that we're all going to experience, that we all need support with in one way or another. And so it's not just the guilt that we feel, it's the lack of infrastructure that we as a society have in place to support, honor, recognize family caregivers. The fact that so many of us are struggling to work while providing care and not being able to take time off because you need that paycheck is a failure not of yourself, it's a failure of our nation and not having a paid family and medical leave policy, for example. So I really appreciate the person who asked that question putting in a spotlight on the advocacy role that kicks in, right? Knowing that, that we, in order to address that systemic failure, we have to continue to lift our voices up like Thomas is doing, and look at those opportunities to put in place policies and engage in conversations around advocacy and public awareness, because that's one way that we can address that issue of guilt for family caregivers at large, is by putting in place that policy change that we need. And I'm hopeful in that respect that we're seeing more and more visibility around caregiving because of the stories that you've all told in the chat, because of folks like Thomas, because of the dedicated health professionals on the Zoom, right, acknowledging caregiving, that we are starting to put in place that awareness that we need to address that guilt through systemic policy change.
Thank you. Thank you so much. Thomas?
Yeah, I was just going to add, I mean, I agree with everything the speaker said previous to me, but I think that the more that we bring Alzheimer's out in the light, like a lot of family members might, not be afraid to, take their parents here or let people know what's going on with their parents. But the more that it's out there and people see what's going on, the less guilt I feel that you're going to feel guilty. It's just normal. But the more that the family's aware of what's going on and they can see, the more understanding they'll be, and they'll be able to comfort you some, and more understanding, and it'll be an easier decision for you. I can only say I have a male relative who's taking care of two parents. A lot of siblings, they don't help it. They're all up north. They don't know what's going on. They're always questioning his decisions. So like I said, we're on Facebook all the time. My mom's always talking about her Alzheimer's and the things that we do and, things. I think it makes it easier when that decision comes for you to have to make it and for other people to understand it, and which lessens the guilt on your behalf.
I want to thank Yolanda Santos, one of our guests, for that wonderful question. And I think it's also part of the Latino tradition is where we always feel guilty, about something, but this is true, especially because it goes along with the respeto we have for our families and so forth. And so it makes it even harder. This one's a little bit tougher. Another question from Rosie. She says, considering the pervasive nature of generational trauma, especially in immigrant families, do your training programs available include validating support for adult children who are now caregivers to the trauma bond parent or abusive parent or family member?
I'm not sure if that came through about the training program I was talking about. I'll pause and see, Melissa, you are a counselor. I don't want to put you on the spot. But I want to talk about sort of the structure of the Caring for the Caregiver program as a whole, and then I'll pass it to Melissa, who brings in that aspect of our program. At Caring for the Caregiver as a UT Health program, we can often serve as a front door to the resources that are offered by the many different partners at the Biggs Institute and within the South Texas Alzheimer's Center. So when caregivers get involved with a program, say like Juntos Together, and they enroll in a 6-week education-focused program, at the same time, they're also being integrated into a support network where they'll be assigned a student who is trained who will call them once a month. They'll be referred on an ongoing basis with tailored referrals based on an assessment provided by our caregiver specialist, provided under supervision of our RN who oversees our program. And from there, if an adult caregiver of a parent, somebody caring for their parent, expresses the need for a space as a supportive space or mental health support, we'll do a warm handoff to our amazing team at the Biggs Institute, Melissa Flores and Angela Torres, who then provide also, and I'd like to invite Melissa to share more about the adult caregiver support program.
Yeah, and I wasn't sure either if that was talking about the Caring for a Parent group that I had mentioned earlier, because that is something that we, Angela, who is a co-facilitator with myself, really take that into mind. This is something that is extremely valid and extremely common in our community and just in other communities, that a diagnosis or an illness doesn't change the relationship or the trauma that was already present before this diagnosis took place. And, that can complicate matters quite significantly if now we're talking about taking on a significant amount of responsibility for someone where the relationship has already been fractured. And so we talk a lot about that in our Caring for a Parent support group. But also I appreciate Sarah mentioning in my role as an LPC, as an individual therapist with individuals, I think that's such an important thing to destigmatize, to create space for, because I can't say it enough. A relationship doesn't change just because there's a diagnosis. In fact, that can make things more complicated when you're now faced with these extra challenges. And so I appreciate that question and just highlighting the space of, it's fair and valid to feel that way. And there's ways of getting support through that, not to change the way you feel, but to balance some of those feelings while still having to navigate all the responsibilities and challenges that you may be facing as a caregiver.
And also some of our patients take on different personalities that were never there before, right? And that sometimes they're a little bit more challenging or can be not as kind and caring, the person that we knew. And how to deal with that, work with that new personality is sometimes difficult as well. Jason, there was a question for you in terms of a national resource where individuals can go to find caregiving support. Do you have something you could share with us?
Yeah, so that's one of the issues. It's very fragmented, right? It's one of those issues where caregiving impacts so many of us and across different, from Alzheimer's to cancer to heart health. I mean, it comes in so many different forms that there's very fragmented information. But I suggest folks check out the Administration for Community Living. They have some great resources. We have at caregiving.org, the National Alliance, we have a Take Care community. I'll put that in the chat that helps to curate resources. And I really agree with Melissa in encouraging folks to check out your local area agency on aging. There's lots of resources there that'll be more localized to your region. So they're a great resource. We're seeing more and more area agencies on aging are really viewing caregivers as their clientels and not just the folks that are aging themselves because of the prevalence of caregiving. So definitely a great resource to check out.
Wonderful, great, thank you. Well, I'd like to ask our panelists to maybe give a last statement or comment that they would like to share, 30 seconds or so with the audience. So Janae, we'll start with you.
Sure. So again, thank you for this time. And if I could leave something from the pharma lens, your journey is important to us. And what's also important is that you're not afraid to use your voice. When I think about the work that we're doing in pharma and we're seeking to develop medicines, but the medicine and the support and the resources that we provide in communities really needs to meet your needs. So I just encourage you to speak up, not be afraid to share your experiences, because it's when we better understand how to support, then we can make a meaningful impact and come alongside you in new ways. So thank you for being caregivers, because I know it's not easy. I've been there. And we're grateful for the countless hours that you put in caring for your loved one.
Thank you so much, Janae. Melissa?
I think I would echo those sentiments. That would be my parting words as well. As I think there's a tremendous encouragement for Latinos and Latino caregivers to advocate for themselves, whether that's in the community or even in the doctor's office. I think that's a big challenge a lot of times is, there's these expectations, or this is how you should do things, when really we should be listening to the caregivers and really understanding what is it that they need and how can we best serve them. And so advocating for yourself, speaking up, finding your voice, and finding support. Those, I think, are the two main components for me.
Thank you. Thomas?
I would just like to say, don't be afraid to ask questions of your healthcare professionals. Don't be afraid to shop around for resources and healthcare professional that fits your needs. If you find resources and a good healthcare professional, share it with everybody you know. And, don't be afraid to ask for help, and don't be embarrassed. This is not something that your loved one or you asked for, but it's something we're going to have to deal with. So just, don't be afraid. Don't be ashamed. We didn't bring this on ourselves.
Thank you. Jason?
Yeah, I end with a feeling of hopefulness, right? I think despite all the challenges that we've talked about, all of the barriers that are in place, one of the things that we see in our data is that over 51% of family caregivers say that their caregiving experience gives them a sense of fulfillment and purpose, right? That is so meaningful, right? That is, and I think, Thomas, you've highlighted this beautifully in your remarks, and it's that purpose and meaningfulness that we need to invest in as communities and as a society at large. And so your storytelling, you lifting up your voices, and speaking out, it gives us the ability to advocate for that kind of investment in caregiving. So thank you, and look forward to seeing all the change that we're able to create together.
Thank you. Claudia?
Thank you. I just want to highlight, consider participation in research, because we really need to start getting answers to our community, from our community. We, from the research perspective, I know we have a lot to do to gain the trust of the community, and we are investing a lot of effort because we want to bring things that are relevant. And right now, there's so many opportunities to learn both, like, what are those risk factors, why those disparities are there, but also new trials and drug development. And there's so much potential, and we want to benefit our community. So consider participating in research.
Thank you. Sarah?
Thank you. Along the same theme, I want to echo some of the sentiments of the many caregivers that we partner with for our research and programs. You are the expert in your experience. You do not have to be a policy expert, a researcher, a provider to advocate for yourself in those spaces. You do not have to be any of those things to know what you deserve, which is better than what our systems and infrastructure are providing now. So I wouldn't be shy to enroll in a study, to tell your doctor that you may disagree with them, or to ask hard questions. We're all here. Please consider each one of us on this call a resource to you. If you want to get involved in research but have been intimidated, reach out to Claudia or me. If you want to get involved in policy, reach out to Jason. If you want to know more about how Thomas has constructed a life that serves him and his family, reach out. We're all here for you. And welcome to our community of caregiver support. So thank you all.
Great. No, thank you. Thank you, number one, to the panelists. Mil gracias. Thank you to all those in attendance. Your remarks in the chat have been amazing. Lots of hearts and claps for Thomas for the work that you're doing. But again, without our research support, we need to move things forward and hopefully find answers for our community. So it's been important to address, Alzheimer's and dementia among Latinos and to address the quality of life for our caregivers and their families. And my underlying statement is do communicate with your families, because I agree with Thomas. And my mother had Alzheimer's and it was hard. My brothers would come to visit and they would sit with me. And I said, no, go sit with mom. She wants to visit with you, and so just sharing those experiences and helping better communicate is extremely important. I also wanted to share with you to get involved, just as Claudia has mentioned. The Biggs Institute here is a site for our brain health registry. All you have to do is to create a profile, answer a questionnaire, and take some online tests of memory and thinking, like playing computer games. So this information will help our researchers learn more about behaviors and conditions that can promote healthy brain aging. So please find out more in terms of how to join. Go to our salud.2/stopad on our Salud website. And we'll be adding this webinar as a YouTube, and we'll be sharing the link for anybody else who would like to share this with any of the other participants who were not be able to join us today. So more from us. We want to again thank our generous sponsor, Genentech. Janine, please give our special thanks to the industry for enabling us to conduct this webinar series. And again, check out all our webinars on salud.2/equity webinars. Mil gracias. You all take care. Have a wonderful day and a wonderful July 4th. Take care.
Gracias.
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 Thank you.